Every year, millions of individuals suffer from spinal disorders as a result of congenital abnormalities, trauma, or even surgical procedures. Depending on the severity, surgical intervention to treat the disorder, or even its symptoms, is not uncommon. Spine disorders are a significant health and social problem, which hinders one's ability to enjoy an active lifestyle. My name is Sophia Shah, and I'm at the University of Calgary. I've written a hypothesis paper for BioEssays entitled Epidural Fat Mesenchymal Stem Cells, Important Microenvironmental Regulators in Health, Disease, and Regeneration. Surrounding your spinal cord is a type of fat known as epidural fat, and up until now, spine surgeons commonly consider it to be a space-filling and biologically inert tissue. As such, they will routinely discard it in attempts to increase their operational field of view. Recently, however, a functional population of mesenchymal stem cells, or MSCs, was discovered within epidural fat. MSCs are multipotent adult stem cells capable of self-renewal and trilineage differentiation into cells that make up mesodermal tissues, such as adipocytes, chondrocytes, and osteoblasts. MSCs play several physiological roles in vivo, including modulating tissue maintenance, repair, and regeneration. Although little is known regarding the biological role of MSCs in epidural fat, their presence in this tissue has led us to hypothesize that the debridement of epidural fat, and subsequently the loss of MSCs, in fact disrupts homeostasis in the vertebral environment and negatively impacts wound healing. For example, dural injuries can cause severe complications, as the dura mater, which is the outermost protective membrane surrounding both the brain and the spinal cord, is essential for cerebrospinal fluid turnover and maintaining intracranial pressure. We believe that epidural fat MSCs maintains the integrity of the dura mater after injury. We further hypothesize that the potential outcomes of epidural fat loss include fibrosis, inflammation, and neighboring tissue degeneration. Moreover, we believe disruption to the epidural fat can lead to decreased neovascularization in damaged tissue, ensuing poor post-operative conditions. However, these outcomes could be rescued by the delivery of epidural fat MSCs, or even epidural fat engineered from MSCs. If this is demonstrated, epidural fat, and by extension epidural fat MSCs, would be endogenous drivers of repair and regeneration. The presence of MSCs in epidural fat suggests that it is more biologically active than historically perceived and should be minimally perturbed from its original location in the spinal canal. Epidural fat has long been ignored, and I believe research into this novel source of MSCs will direct our focus towards a repair mechanism that is endogenous in nature and can directly impact clinical care. In re-evaluating the common practice of removing and discarding epidural fat, many of us will potentially get back to doing what we love most, without the accompanying pain.